Hello, fellow healthcare enthusiasts, and welcome back to Wally's nursing videos. Today, we embark on a crucial aspect of pediatric nursing: dosage calculations for our little patients. As healthcare providers, ensuring accurate and safe medication administration to children is paramount. In this video, we'll demystify pediatric dosage calculations, breaking down the complexities and offering practical insights to boost your confidence in handling medications for the youngest members of our community. Whether you're a nursing student, a seasoned healthcare professional, or someone seeking to deepen their understanding of pediatric care, join us as we navigate through the intricacies of dosage calculations, empowering you to provide optimal care to pediatric patients. Let's dive into this essential skill set and ensure the well-being of our youngest and most vulnerable patients. I'm Wally, and this is Wally's nursing videos. Let's get started. Dosage in pediatrics. Unlike adults, in which most medications already have a set dose, in pediatrics, it is necessary to calculate the dose to be administered according to the weight in kilograms, kg, or the body surface. The most used pediatric medication dose calculation is based on the patient's weight in kg. However, the most exact method is the one that uses the body surface. General aspects for the calculation of pediatric dose. To calculate the pediatric dose of a drug, you need to know three essential data: patient weight, kg, drug dosage, presentation of the drug. It is preferred to work with the weight in kilograms. Most of the literature and doses are expressed in kg. Therefore, if the patient's weight is in pounds, it will be necessary to convert it into kg. It is also important to pay attention to the dosage of the medicine. Some medications bring their dose expressed in a total to be administered during the day, while others express it in doses to be administered every certain number of hours. For example, the paracetamol dose is 10-15 mg/kg dose every 6 days. This means that this dose can be repeated every 6 hours. But the Suffixime dose is 8 mg/kg day. Video of how to calculate pediatric dose. How to calculate the dosage of medicines in pediatrics. To calculate the pediatric dose of a drug, the weight in kg or the body surface can be used. However, the most used method is based on weight in kg. In this article, I will explain you step by step how to do it. Pediatric dose calculation according to weight in kg. The first thing we must do is calculate the total dose to be administered of the medication, which we obtain by multiplying the dose by the weight of the patient. So it is imperative to know the patient's weight. If for some reason it is not possible to weigh the patient, their weight can be determined using the ideal weight formulas. Calculate the dose of paracetamol. For example, the dose of paracetamol is 10-15 mg/kg dose. This means that we can use a dose of at least 10 and a maximum of 15 mg. In this example, we will use a 15 mg dose in a child weighing 12 kg. Therefore, the total dose to be administered is total dose is weight of the patient in kg, x dose of drug. Total dose is 12 kg x 15 mg x 180 mg. In this example, 180 mg is the total to be given. But no is what we will give the patient. Before giving the indication, we must know the presentation and concentration of the drug. Paracetamol, for example, can be found in various presentations: as a tablet, as a suppository, or as a syrup. In pediatrics, most of the medications that are administered orally are preferred in syrup. Therefore, it is necessary to know the concentration in milliliters, ml, of the drug. Acetaminophen in presentation of 120 mg 5 ml. Depending on the brand and manufacturer, concentrations may vary. In the case of paracetamol syrup, the most common concentration is 120 mg of 5 ml. So continuing with the example, how many ml should we give to our patient? For this, we must apply a rule of 3. Or just remember that the total dose to be administered must be divided by the mg of the medication presentation and the result multiplied by the ml of the medication presentation. ml to be administered, SO, total medication dose, mg of presentation, x ml of presentation. ml to be administered, 180 mg, 120 mg, x 5 ml, A 125, x 5 ml. 7.5 ml every 4-6 hours. Calculate pediatric antibiotics dose. The process is the same as with most medications. We must know the patient's weight in kg and calculate the total dose to be administered. The majority of antibiotics administered by oral route come in the form of syrup. The classic example is amoxicillin, which has a dose of 80 mg/kg day divided into doses every 8 or 12 hours. The dose of amoxicillin is expressed as a total to be administered every 24 hours. Therefore, This dose should be divided by 3 if it is given every 8 hours, or by 2 if it is given every 12 hours. If we put it into practice with the patient in the previous example, which we remember that weighs 12 kg, then we will have total dose A 12 kg x 80 mg x 960 mg. Now we must know the presentation and concentration of the drug. The most common presentations of amoxicillin are 250 mg 5 ml and 125 mg or 5 ml. In this example, we will use the 250 mg 5 ml presentation. ml to be administered, ECs 960 mg, 250 mg, x 5 ml, E384, x 5 ml, E192 ml. Remember that 19.2 ml are equivalent to 960 mg of amoxicillin. The dose to be administered each day. However, this should be divided into 2 or 3 takes. So if we indicate it every 8 hours, it would remain ml to be administered every 8 hours, 8 to 19.2 ml, 3 8 to 6.4 ml every 8H. Why between 3? The reason is simple. Since we want to administer this drug every 8 hours, we must divide the 24 hours a day by that interval. So 24 8 8 3. If it were every 12 hours, it would be 8 24 12 8 2. Pediatric dose calculation in special situations. Certain medications may seem a bit more complicated. Trimethoprim sulfamethoxazole is an antibiotic whose dose is 8 mg kg day divided into doses every 12 hours. But its presentation in syrup is 40 ml, 200 ml, 5 ml, which essentially says that it has 40 mg of trimethoprim and 200 mg of sulfamethoxazole every 5 ml. But when calculating the pediatric dose, it is based on trimethoprim. If we use the same patient from the previous example, then the calculation would be total dose 8 12 kg, x 8 mg, 896 mg, ml to be administered, EK 96 mg, 40 mg, x 5 ml, E24 x 5 ml, ACE 12 ml. ml to be administered every 12 hours, ACE 12 ml, 2 8 to 6 ml every 12 hours. Pediatric doses of drugs in drops. On occasion, it may be necessary to indicate the number of drops to administer of a medicine, especially in those whose doses are usually low or for the convenience of the patient's parents. An example of this is Cefixime. It has a dose of 8 mg kg day. In this case, the dose is every 24 hours. The presentation is usually in syrup with a concentration of 100 ml 1 ml. If we calculate the dose to be administered in a child weighing 10 kg, it would be total dose ACE 10 kg x 8 mg 880 ml to be administered as 80 mg, 100 mg x 1 ml no 8 x 1 ml a 0.8 ml every day. It is impractical for the patient's parents to calculate the 0.8 ml. In these cases, it is preferred to indicate the medicine in drops. In addition, many medications such as Cefixime usually bring a dropper for the administration of the medication. So how many drops should we give the patient? To calculate the dose of medicines in pediatrics and drops, we only have to multiply the amount of ml to be administered by 20. Remember that 20 drops make 1 ml. Drops to administer is ml to administer x20. Drops to be administered equals 2.8 ml x 2816 drops every day. Adjust dosage of medications. Occasionally, we will have to adjust the dose of a medication for reasons of comfort for the parents and the patient, or for the convenience of the personnel who will give the medicine. The important thing in these cases is to always take into account the dose range of the drug. For example, a 7-year-old child who weighs 21.2 kg and who should be given paracetamol would have a total dose of 318 mg, calculated at 15 mg kg dose, and we should give him 13.25 ml every 6 hours. However, it is impractical, especially for inexperienced staff like parents. Calculate the 1325 ml. Therefore, it is perfectly valid to adjust the dose and give the patient 13 ml of paracetamol every 6 hours. The same can happen when administering the drug in tablets or pills. Sometimes it may be necessary to adjust the dose of the medicine. For example, if in the same previous case we had to give prednisone, 5 mg tablets, to treat a recurrent bronchospasm crisis, then how many tablets should we give the patient? Hadge pills. A total dose, concentration of the pills. So the first thing is to calculate the total dose of prednisone, which has a dose of 12 mg kg dose, which can be repeated every 24 or 12 hours. In this example, we will calculate it at 1 mg kg every 12 hours. Total dose 81 x 21.2 kg, E21.2 mg. Then we must give Hatch pills ACE 20.2 mg or 5 mg A424 pills. Hatched pills every 12 hours, E and 424, 2, 8, 2, 12 pills every 12 days. We cannot expect even the most meticulous parent to try to cut each pill to exactly give the 4.24 pills. So it is necessary to adjust the dose to 2 pills of prednisone every 12 hours. Calculate pediatric dose of intramuscular and endovenous drugs. Medications administered intramuscularly, IM, or endovenously, EV, are calculated in the same way as those administered orally, PO. The difference is usually when they are indicated and whether or not they require dilution or reconstitution. Simple drug calculation. The calculation of the dose of medications administered by IM or EV is basically the same as those administered by PO. For example, diclofenac. It has a dose of 0.5 to 1 mg/kg, dose which can be repeated every 8 hours. The most common presentation of diclofenac is 75 mg or 3 ml. If we calculate the dose to be administered to a 6-year-old patient whose weight is 20 kg, then we will have total dose, E 20 kg, X 1 mg 820 mg. The indication would be valid as diclofenac 20 mg IM/C 8 hours. However, remember that the medication will be administered in ml. Therefore, it is necessary to determine how many ml should be administered via IM to the patient. Process that is identical to the one used in the previous examples. ml to be administered, E 20 mg, 75 mg x 3 ml, E02E6, x 3 ml, H08 ml every 8 hours. Drug calculation with reconstitution. Certain medications essentially only require the calculation of the total dose. An example of this is usually benzathine penicillin, which usually has a dose of 50,000 units, U, in a single dose. So to indicate it, it would be enough to calculate the total dose. For example, in a child who weighs 14 kg and has acute pharyngotonsillitis, the dose would be total dose ACE 14 kg x 50,000 U x 700,000 U single dose. The indication could be as benzathine penicillin 700,000 units IM/1. However, it is vital to remember that penicillin is usually presented in powder and requires reconstitution before it can be administered. What is the reconstitution of a medication? It is the process of adding a solvent to a drug in the form and quantity necessary for proper administration by the indicated route. In simple terms, it is to convert a drug, usually in powdered form, in a mixture which can be administered orally, intravenous or intramuscular. Reconstitution of the drug. The presentation of penicillin is usually 1.2 or 2.4 million units with 5 ml of sterile water. So how many ml should be given to the patient? The first thing is to do the reconstitution of the medicine. For this, the 5 ml of water or solution is placed in the penicillin powder. The mixture is stirred to obtain a homogeneous, lump-free solution. Now it is necessary to determine the concentration. In the case of benzathine penicillin, whose presentation is 1.2 million units, when diluted in 5 ml, we obtain a concentration of 240,000 units, 1 ml. Drug concentration of presentation. Amount of ml for reconstitution. Drug concentration A, 1,200,000 units. 5 ml ACE 240,000 units per 1 ml. As we will give our patient 700,000 units, the amount in ml to be administered will be ml to be administered and 700,000 U, 240,000 U, x 1 ml I 2.9 ml. The calculation of drug doses in pediatrics always follows the same pattern. In some cases, it may be necessary to indicate the drug in an intravenous infusion. What you can read here. We are writing the article. Calculate pediatric dose based on mg or ml administered. Occasionally, we will have to know the dose at which a drug already prescribed or indicated is calculated, whether you're receiving a referral patient or are in medical guard. In pediatrics, the ideal is always to verify the doses of the medications. Formula to calculate pediatric dose based on mg administered. Then, to calculate the pediatric dose of a drug based on the mg administered, we will apply the following formula. Medication dose, EGAs mg administered, weight in kg. For example, if we have a 3-year-old child weighing 14 kg with an indication from the previous medical guard that says gentamicin 70 mg EV every 24 hours. What dose did they use to calculate gentamicin? Medication dose A70 mg, 14 kg, A5 mg kg every 24 hours. Which is correct because gentamicin has a dose of 7.5 mg kg a day. It is important to bear in mind that the formula tells us the dose of the medicine in the same interval of hours that is indicated. So sometimes we will have to verify if your dose is correct in a range of 24 hours. Formula to calculate pediatric dose based on ml administered. The procedure is similar to the previous one, with the only detail that it is necessary to first calculate the dose in mg based on the ml administered. Therefore, it is also imperative to know the presentation and concentration of the administered drug. Then the formula would be Step 1, mg administered ACEs, ml administered, ml of presentation, x mg of presentation. Step 2, medication dose x mg administered, weight in kg. For example, suppose we receive a 1-year-old child weighing 10 kg and we see that it has as indication paracetamol 120 mg 5 ml, 6 ml VO every 4-6 hours due to fever. So how many mg are being given to the patient in total? And what dose did they use to calculate it? The first thing will be to determine what is the total dose in mg administered to the patient based on the ml of paracetamol. mg administered A 6 ml, 5 ml x 120 mg, E 12 x 120 mg, 8 144 mg. Now that we have the total mg administered, we can find the dose at which it has been calculated. Medication dose on 44 mg, 10 kg, E's 14.4 mg, kg dose. Which is correct because the dose of paracetamol is between 10-15 mg kg dose. Also in this example, the dose of paracetamol has been adjusted. If it is calculated at 15 mg kg dose, it would touch 625 ml every 4-6 hours, which was impractical. As we conclude our exploration into pediatric dosage calculations, I hope this video has equipped you with the knowledge and confidence needed to navigate the intricacies of administering medications to our little ones. Remember, precision and attention to detail are paramount when it comes to pediatric care. If you found this video helpful, please give it a thumbs up, share it with your colleagues, and subscribe to Wally's nursing videos for more insightful content. Your engagement and support drive us to continue creating educational materials for the healthcare community. Feel free to leave any comments or questions below and let us know what topics you'd like us to cover in future videos. Thank you for joining us on this learning journey. Until next time, stay dedicated to excellence in healthcare, and I'll see you in our next video. This is Wally signing off.